evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us. So, the topic of today's session is Heroes Fight for Health. Join the Prostate Cancer Awareness. And this initiative is supported by Zydus Life. Prostate cancer is a significant health concern in India, ranking as one of the most prevalent cancers among men. According to WHO data, prostate cancer accounts for approximately 7.7% of all the cancer cases in Indian men, with the estimation of 105,000 new cases reported this year. Additionally, it is a leading cause of cancer related deaths with approximately 30,000 fatalities in 2020. These statistics highlight the urgent need for enhanced early detection, prevention strategies, and treatment options to address the growing impact of prostate cancer in the country. So, in this session, we are going to discuss and highlight the holistic prostate cancer care by integrating physical, emotional, and psychological support. To begin with the discussion, first I would like you all to join me in welcoming our expert who is going to provide us with insightful information on understanding about the prostate cancer awareness. So I would like to welcome Dr. Shivam Shingla, consultant medical oncologist, SL Raheja Hospital, Mumbai. Good evening, Dr. Shivam. Welcome to the panel discussion.
Hi, Dr. Sumedha. It's a pleasure to be here.
So let's delve into the discussion. So, to begin with the discussion, could you please provide an overview of the current state of prostate cancer awareness in India and what are some of the major challenges that patients face?
Sumedha, prostate cancer is a disease which is very prevalent among men. The problem is this is a disease which affects men above the age of 60 to 70 years. And the problem is that the symptoms are so overlapping with the normal day to day symptoms of urinary trouble that men face in this age. They generally don't come to know whether they've got a prostate cancer or not. The prevalence is so high that when you talk about any man who's above 75 years of age, you look at their prostate biopsy, 5 out of 10 men will have a prostate cancer hiding inside. So, all men above 75 are at very high risk of developing prostate cancer. To alleviate this high risk, there is a general guideline to do a PSA test, by the age of 60 years. But I will be telling you the truth. The fact is that none of the patients who come to me by prostate cancer have been detected by screening. Majority of them have had the disease progression, advanced disease, and then they come to me. So as far as awareness is concerned, we are significantly lacking behind, and men really need to come forward for a routine PSA checking after the age of 60 years to prevent any devastating impact of this type of cancer.
Thanks, Dr. Shivam, for the insights. Moving ahead with this question only, I would like to ask, like, what are the some common major challenges that the patient face?
So challenges is that once he is diagnosed with prostate cancer, the challenge begins when it is metastatic, when it is already spread to different part of the body. Of course, developing a cancer itself is a major psychological dent to any patient, and it really is very difficult to accept that you've got cancer. In early stages, it is curable. Stage 1 and 2 and 3 also it is curable, but the treatment is demanding. Patients require hormone injections and they require surgery or radiotherapy, which also have a lot of side effects relating to the disease. The best outcome in a prostate cancer is early diagnosis, and the more and more patients we are able to diagnose at an early age, that's the best outcome for such patients.
Thank you, Dr. Shivam, for such insights. Moving ahead, I would like to ask what role do the healthcare professional play in advocating for prostate cancer awareness and how can they better engage with the community to promote the early detection and the treatment plans?
I think we need to create awareness in the community. We need to go to places where elderly people come. So generally in temples, in gurdwaras, in places where elderly retired people come who are above 60, they are at the higher risk of developing prostate cancer. So as a community, like in the parks and where the elderly people come, we need to educate these people that if they have symptoms of urinary symptoms, or have they done their routine PSA check? A PSA check is a 200 300 rupees test, and it can detect prostate cancer in a very early stage. It's a very sensitive test. So, as far as the healthcare workers are concerned, I think the message from our side is that all the listeners there and individuals who are having elderly people at home or people who are above 55, 60 years of age, just get them a routine PSA check, which is a simple blood test. So, this generally can lead to an awareness. And if one individual who is above 60, he can call up all his friends, and tell them that, have you got your PSA check? So as more and more people come out, they educate more and more people to get their PSA check done. I think we can really contain and control this cancer going forward.
Very rightly said, Dr. Shivam, that screening and diagnosis is really important. Onto this, can you discuss the importance of early screening and diagnosis for the prostate cancer, and what are some effective strategies for encouraging men to get screened?
So one of the effective strategy to encourage men to get screened is probably giving them, a knowledge about the disease, telling them that if you don't get screened, there are challenges that you are going to face. Other strategy could be, the government gives them a free PSA check after the age of 61, free PSA check, or it becomes mandatory for them to take the subsidy schemes if they get their PSA done. In this way, I think once it becomes mandatory, people would really check. Like in Japan, it's probably mandatory to get a endoscopy done because they have a very high incidence of stomach cancer. So they have really reduced their burden of cancer by making a mandatory endoscopy check. I think the time has come that in India also we do a mandatory PSA check. As far as your first question is concerned, I think we really need to, as a society, come forward. We need to encourage men to, accept that there is nothing to fear from prostate cancer. The patients who get detected in early stages of prostate cancer, where the tumor is T1 or T2 size, then these patients can just directly take, 5 days of radiotherapy and they're cured. So, as the stage increases, if you don't screen it in time and the stage increases, then your patients have to undergo the extra burden of surgery, and then there can be a lot of problems. And if the disease spreads, then it's a lifelong disease where eventually the life is also contained for 5 to 10 years. So, there is a lot of incentive to screen it. Early screening can detect to a very easy treatment, which can just be in the form of radiotherapy for 5 days. In UK, they did a study. They said that in early stages, if you just give radiotherapy 5 days, these patients are cured forever. So we must look at screening and try to detect every patient in stage one.
Thanks, Dr. Shivam, for the insights. Moving ahead, what are the most common side effects that people face during the treatment, or maybe before than that, and how is differential diagnosis is really important for that?
So, differential diagnosis is important because, see, prostate cancer symptoms are very much similar to a condition known as BPH. So, benign prostatic hyperplasia. So, majority of the males above 50, 55, 60, they have a condition of BPH where they are seeing their urologist for regular medicines for urine flow and other things. So, that leads to a misdiagnosis because most of the times people confuse BPH with prostate cancer, and then we miss this. The first part to your question, that how do you sort of go ahead, the side effects of treatment. One of the biggest side effects is that when we are treating this disease, we have to reduce the testosterone levels in men, and we have to practically make them zero. So once we do that, then patients, they lose their sexual desire and their sexual drive. So that is one of the major side effects of the treatment. Then, as far as the other side effects are, that with the radiotherapy or the surgery, sometimes people lose control on their urination. So they don't have a full control of how to urinate, and this can lead to significant, trouble for 2 to 3 months. Then sometimes you have to give chemotherapy for such patients, and then chemotherapy has its own side effects, weakness and taste loss and other things. So yeah, it's better to avoid most of these troubles and detect it in an early stage. with screening and other processes.
Thanks, Dr. Shivam, for providing us with the side effects. Moving ahead, how can a patient and their families be educated about the risk factors and symptoms of prostate cancer to help them make informed decision about their health?
So, as far as the risk factors are concerned, I think the risk factor includes if you have a positive family history, then it's a risk factor. It is known that patients who have had prostate cancer in family, they generally end up with prostate cancer in their children also. So, children whose parents or grandparents have suffered from prostate cancer, they obviously need to screen it. Uh, Education wise, I think the symptoms in early stages are pretty much similar to any obstructive symptoms like a BPH. So most of these patients, you should visit your urologist, when you get BPH symptoms and do a routine PSA. Now, majority of the urologists are doing a routine PSA check every 1 year, every 6 months. More than that, I think as men, we should make it a point that when we are above 60, every year we get a routine PSA check. Symptoms generally come in later stages of cancer, and screening detects the cancers in very early stages where the cancer is practically asymptomatic. So, aim of our screening process is to detect them at a stage when they are asymptomatic, and yeah, so try to detect them early is the main goal.
Thank you, Dr. Shivam. Moving ahead, in your experience, how does a holistic approach to prostate cancer can differ from traditional methods, and what are the key components of holistic care in this context?
So, holistic care means that you have a cancer care physician, and in that case, I am one of the cancer care physicians. Then you have a psychological counselor, because most of these men they undergo psychological stress. Then you have a lifestyle coach who helps you through the process of cancer care. And then, if you need a surgeon, then you have a surgeon involved or radiation oncologist involved. There is someone who's guiding you as far as the nutrition is concerned, what kind of nutrition you must take while you are on treatment. There is an institute where you get social support, you have care, support groups of different people who are there to support you during the treatment. Patients who achieve holistic care, they traditionally end up doing better than other patients. So yes, holistic care is very helpful in majority of the patients, and people who achieve holistic care, they end up having a better outcome.
Thank you, Dr. Shivam. Moving ahead, in your opinion, how does multidisciplinary team approach helps the prostate cancer patient to get the more better treatment, and how it is important for them?
For every cancer, for any stage, there is not one right answer. You have to understand that. So, for every stage, there can be multiple decisions that, okay, we can go for surgery, okay, it's an early stage, we can give radiotherapy, okay, the patient is not fit for radiotherapy right now, we can do some hormone therapy. So in this case, when we sit down as a multidisciplinary team, me and my colleagues, we sit down and we discuss the positive possible benefits depending upon different data that have been available all over the world. So multidisciplinary approach, we sit down, we do a tumor board, and we discuss what is the best way forward for each individual patient. And this kind of a approach is generally very beneficial for patients, as you get the best decision. One decision maker, I think two or three are better because the outcomes they improve with more minds on the same job.
Thank you, Dr. Shivam. Moving ahead with the treatment part, what are the latest developments or maybe latest clinical trials are there which can help prostate cancer patient to get the more better treatment?
See, we've developed a lot of treatment for prostate cancer now. One of the biggest improvement in the treatment which has happened is the presence of a robotic surgery. So today we have ability to do a surgery without cutting open the abdomen. We make small holes in the abdomen, and we remove the prostate with the help of small pin size holes and robotic arms. So the surgeon is sitting behind a computer screen, and the machines are actually operating on a patient. So with this, the patients they end up getting discharged the next day. The second major improvement in prostate cancer has been to understand that all of the patients don't need treatment. So, approximately 40% of the patients have a low grade disease and they can be under observation and their disease does not progress very rapidly. The third major new development in prostate cancer is the presence of very precise radiotherapy techniques. Now, today, when we used to give initially 30 days, 40 days of radiotherapy, today we can give radiotherapy for as less than 5 days, and such patients don't have much side effects. In terms of treatment of advanced diseases, there is a lot of improvement. We have lutetium therapy, which is a targeted therapy now, which is like a PET scan we do, and then we give radioactive material which destroys the prostate cancer without any side effects. There has been a lot of improvement in prostate cancers which are called genetically. So we have now developed advanced oral tablets which can control these cancers for a long, long time. Yeah, there has been a lot of improvement in the treatment part.
Thank you, Dr. Shivam, and I think it's really enlightening to know about these latest development for the prostate cancer treatment. Moving ahead, how can integrating physical, emotional, and psychological support improve patient outcome and quality of life for those with the prostate cancer uh, suffering?
So I'll give you a simple analogy. When I travel in my car in the traffic in Mumbai, and I'm afraid of the speeding cars nearby, and I'm not very confident in my driver, so my journey is very difficult. Even if it is 5 kilometers, I live in fear during those 30 minutes or an hour. Similarly, a prostate cancer patient who's not had a counseling done, their journey is also difficult. And this leads to poor outcomes. So we need to educate these people, we need to take out the fear, the biggest fear of treatment failure, the fear of what is going to happen next, the fear of the side effects from these patients. And in this aspect, psychological counseling definitely helps. I always believe a confident player is someone who succeeds rather than a skillful player who's not confident. So for me, I think psychological part is something which is very important. I, especially in my practice, also try to tell patients that one thing we are not going to do is getting afraid from this disease. You've got very good treatments for this disease. You just need to take care of your health and take care of your lifestyle. And this will help you to
Dr. Shivam, you're not audible. Can you hear me? Dr. Shivam, can you hear me? नहीं नहीं बंद ही कर दो उसको.
Yeah, I'm sorry. I just had a network glitch, so I'm back. So yeah,
Yeah.
so yeah, this helps. I mean, psychological support does greatly help the patients. Go on.
Thank you, Dr. Shivam, for such insights. Moving ahead, what role do the lifestyle changes such as diet and exercise play in the overall management of prostate cancer? Are there specific recommendations that you want to give to the patients?
So generally, diet is very important. Obesity is the prime cause of 30% of the cancers. So I generally recommend patients to have a good, healthy lifestyle, a good diet. Once you're detected with cancer, I think patients should take a lot of green leafy vegetables, the foods which are rich in antioxidants. That not only helps to fight the disease but also prevents the side effects from the ongoing treatment. The other part is exercise, regularly exercising at least 2 hours in a week with moderate intensity exercise. World Health Organization has also said that would reduce the burden of cancer by 30% in all individuals. Uh, Avoid alcohol and smoking. Alcohol has a compound called aldehyde, which generally increases risk of all types of cancers. So uh, it's a good habit to give up alcohol at some point of your life and move towards a more holistic and a simplistic life. I've always found patients doing yoga and meditation, and they've always done better as compared to patients who've had a very exorbitant lifestyle.
Thank you, Dr. Shivam, for these recommendations. Moving ahead, can you discuss the importance of mental health support for prostate cancer patients and how it impacts their treatment and recovery?
I think mental health is something which is very under discussed topic in the country, and generally people don't talk about the mental health. For me, the barometer is to have a mental health assessment of a cancer patient. They are very fragile when it comes to the mental health. There is a lot of trauma that they suffer every day, and this trauma generally comes from the environment around them. One of the reason is the negativity which surrounds them, the fear of unknown. Google also feeds a lot of negativity to majority of the patients, and patients tend to Google their disease and they always get wrong information regarding the stage of the disease and the outcome of cancer patients because it is filled with horrific stories. So, mental health, if addressed properly, is very important in a good outcome for majority of the patients. Uh, we really need to address it in all of our patients, and I hope that someday in the country we'll have a very strong mental health program, especially for cancer patients. The only one good way that I've found out that people can get a good mental health is to have daily interaction with their friends. I think friends are the most important support group. So whenever any patient has got a cancer or anything, he must regularly and constantly meet with friends and try to carry on a normal or a near normal lifestyle.
Very rightly said, Dr. Shivam. And I think this age group, the people suffering most with the prostate cancer is geriatric age group. And the people are already very vulnerable towards it. They really need that mental support to their ongoing journey. Moving ahead to the patient advocacy, what kind of support system should be in place for prostate cancer patients and their families to navigate their journey more effectively?
I think now we have a lot of support systems. There are care groups, there are support programs for majority of the patients. They need financial support for sure, but they also need emotional support. Uh, what we don't have in India so far is a patient advocacy groups where set of patients from the same disease can come together and they sit down and support each other. These are known as support groups. It's a very typical practice in US. Even after treatment, patients would come together in a group, assemble, and talk to each other about the post-treatment trauma and other things. So I think in India we lack that, but I think the future that is something which is going to be there. And overall, families they need support. Fortunately, in India we have a fantastic family support structure that every patient typically has about 5 to 7 people who would accompany him or her to the hospital, and that's a great support. In US, on the contrary, the hospitals have to send caregivers to fetch patients from their say homes or other places. So from that point of view, we are very blessed as a country that we do not have a paucity of people who stand by us. So yeah, there is a lot, but there is a lot that needs to be done.
Thanks, Dr. Shivam, for the insights. Moving ahead, in what ways we can improve communication between patient, the healthcare providers, and the support networks to ensure comprehensive care and support?
I think communication is very important. Patients should come forward and share their troubles with their physicians. Sometimes they feel that their questions may be stupid, and they Their emotions hide the true questions that they want to ask. So I kind of request all my patients to sort of come and unmask their emotions and address the real issues. At times, the real issues are pretty simple, but the emotional uh, baggage is a lot. The other way, which really helps, is to spend time with the patient. So I have realized the more time as a physician I would spend with the patient during or after a consult and try to understand what is going on in their house and daily life, it really helps me to understand what is their threshold of coming forward to me and discussing their real issues. Uh, communication, better the outcomes. So if I know the pain and trouble of my patient, not only from the disease but financial and other social, then I can sort of help and guide them because I've been there, I've seen that, I have seen many patients go through it. So I do understand what all needs to be done, and sometimes simple remedies they solve bigger problems. We may think our problem is very big until we don't discuss with someone who's been through it and has found a simple solution to that problem. So I encourage all patients and relatives to come forward and share their queries, share their troubles with me, so that I can find a viable solution to majority of their problems.
Very rightly said, Dr. Shivam. In order to conclude, what message would you like to share with the viewers who may be facing prostate cancer or be concerned about their health? How can they take proactive steps to manage their conditions effectively?
So I think the one and the only message I sort of give to all cancer patients is not to be afraid from any situation or any disease. I think as a human nature, we were supposed to be the most fearless species on this planet, and that is how we survived the jungles and 100 times more powerful animals than us. I mean, we've made ships which are bigger than whales, and whale is the biggest animal on this planet. But when it comes to our own health, we are very afraid. Uh, that is totally contrary to what nature has taught. So I request patients and I discuss with them not to be afraid from any disease. Uh, everything has a solution. Science has advanced a lot. It's only our fear that leads us into deeper and deeper ditches and a deeper and deeper, trenches. When we let the fear go, then the darkness also goes, and we see a light. So, my recommendation to patients is to come forward and not be afraid of any situation. If you're not able to find a solution, change your physician. Have a second opinion. Have a third opinion. And if there is no solution, then don't be afraid. There is no solution to most of the problems in the world. It doesn't mean that we need to be afraid. So I request all of them to give up their fear, come forward. We can defeat cancer. We have defeated cancer. Majority of the patients have done it in the past, and you can also do it.
Well, that's really encouraging, Dr. Shivam. Thanks for these insights. So, in conclusion, our objective for today's discussion was to explore and emphasize the importance of holistic prostate cancer care by integrating physical, emotional, and psychological support. And I'm confident that our experts have addressed this topic comprehensively and effectively. I would like to extend my sincere gratitude to Dr. Shivam for his insightful contribution and sharing his expertise with us. Your participation has been valuable. Thank you for joining us today and contributing to this important conversation. Thank you so much.
Thank you, Dr. Sumedha. Thank you, Zydus. And thank you, Voice of Health. May God bless you with a lot of success in future and your listeners a lot of good health. Take care.
Thank you. Thank you so much.